Okay. Hello, my name is Dr. Nanita Rai and I'm a cosmetic dermatologist. I hope you all can hear me, whoever will join. I hope you all can hear me because today I'm going to listen to what people are asking me and I'm going to answer them. But I have already noted some of the questions where my patients, where my relatives, my friends have asked me who cannot join online today. So they have asked me a couple of questions which I have jotted down and I'm ready to answer here, even if a lot of people are unable to join Instagram because it's Sunday, it's family time, it's rest time. So I can very well understand that many of us can't, join Instagram live. So hello, whoever have joined, and I hope all are having good Sunday. Instead, means despite of this pandemic situation, we all are getting vaccinated. We all are getting tested, and not only by pandemic, but we're getting tested by our daily life challenges. So, well, I am dermatologist and cosmetologist because lot of my patients who are online and also who comes in the clinic, they are really confused who I am. I am Dr. Nanita Rai. I am dermatologist, that is skin specialist, and also cosmetic dermatologist. I do skin surgeries. I do cosmetic treatments like lasers, pills, microneedling, injectables. So I don't go through plastic surgery like a lot of the patients who are actually searching me on Google and Facebook. They are asking me, "Are you a plastic surgeon?" No, I am not a plastic surgeon. Plastic surgeons are capable of operating from one layer to another, and they change your appearance completely. I don't change your appearance. I go with your original appearance, but I do beautification. That's why it's called cosmetic medicine, cosmetic surgery in dermatology. So, my job is to beautify you because you're already beautiful. All my patients who ever come, they all are beautiful because we all are human beings with two eyes, nose, lips, and most important, brains. We have brains to think, so we all are beautiful human beings. So, I don't need to change your any part, but I can beautify it. And cosmetic medicine deals with beautification and anti-age. So that's why I'm also known as cosmetic dermatologist, and I deal with a lot of clinical skin problems too, like fungal, acne, psoriasis, eczema, scabies, infection with deep vein thrombosis. They have this stasis dermatitis, um, psoriasis, lichen planus, etc., and so on. I see patients who are clinically affected also, and I meet a lot of patients with hormonal issues and hormonal acne, and a lot of them wants cosmetic treatment for it. So I provide those treatments also, like medical peel, lasers, and there are other problems besides acne, that is rosacea, which looks like acne but it is not acne. It is there since long time, and whenever you have stress, whenever you have sunlight, and you have other consumption of alcohol and spice, you get redness, you get eruptions on your face. So this is a typical sign of rosacea. So I come across patients with rosacea, acne too. So today I'm here to talk about cosmetic treatments with a lot of skin problems. So the cosmetic treatments which I provide is lasers. I don't have Q switch laser for tattoo removal. I don't have those lasers. I don't have lasers like carbon fractional lasers, which are also used for tattoo removal and skin, melasma removal, pigmentation removal. I have other lasers like IPL. I have for facial hair removal, and I have lasers like plasma pen, which I use for mole removal. I use for minor pigmentation and rejuvenation of skin, like anti-wrinkle, for tightening. I have a HIFU machine, which is a beauty machine. I call it beauty machine. It has got low ionic frequency and red light, and I use red light, blue light, green light. So all the light therapy I give on the face, and I give injections for like botox, fillers, plasma rich platelet factors, growth factors for anti-age, wrinkles, sagging, and also do scar treatment for burns superficially, and I give them good results with injectables, which consist of 5-fluorouracil and other hyaluronic acid, and also in combination with some kind of lasers, so I do subcision injectables also, which is like injecting beneath your subcutaneous layer, and I do a lot of treatments cosmetically, which will not be actually changing your physical feature or any body part, but it will definitely give you better look than the way you are. Like, you are already good, but it will give you enhanced look with cosmetic treatment in dermatology. So definitely there are people who comes with hair fall and they like to have hair growth with PRP plasma, therapy. Um, uh, and PRP is right now very, very famous for hair growth and skin rejuvenation, for skin, anti-age therapy, and it gives you kind of treatment like Botox and fillers, because it is your own blood which we extract from the machine, and then after centrifuging it, after extracting the plasma from your whole blood, uh, we have that growth factor in that plasma. A lot of growth factors are there, so we inject that into your skin directly on your scalp, which will help you rejuvenate your hair growth and skin and texture of your skin, dark circles, puffy eyes, and these are the cosmetic procedure which I am following right now in my clinic, that is Neo Skin Clinic in Champasari More, Siliguri. And you can always contact me on WhatsApp 7070000787, and also follow me on Instagram dr.nance, or follow my page on Facebook Neo Skin Clinic or Dr. Nance Skin Clinic. So you can follow me there and keep in touch. I will always answer your queries, whatever queries you have, because I have jotted down a lot of questions where patients have asked me that what is the guarantee that I give them after spending so much money. Of course, I my range of treatment for patient is not expensive. I may say it might be expensive for lower people who have earnings like 10,000 or 5,000 per month. It is very expensive for them, but people who earn more than 20,000, I think so the price which I have in my clinic is very reasonable and you get better results. Yes, the guarantee is always there. I might say not 100%. Uh, Whatever fillers, Botox I go through, Botox are mainly for wrinkles, for nasal flare, to shape up the nasal flares and to give a little bit lift on the recursus muscles, our smile muscles here, give lift to our wrinkles on the forehead. So this Botox procedure guarantee I can give you that you have to wait for 3 months max for the results to come up, and it might last for 6 months, 1 year, or 2 years according to the type of lifestyle you have. Like if you smoke, if you drink daily, you party a lot, you don't sleep at night, you eat very less, or you eat like outside hotel food, restaurant food, then definitely the Botox will give you very minimal effect, and you might not get any difference, because it will dissolve and it will go off, because these are cosmetic injections, and it will give you results when you really exercise, you have proper diet, and you don't smoke and drink, and you sleep well, you have good lifestyle. Then yeah, definitely the results come early. And also it's age. If you are 25 plus to 30, or maybe you are 26 plus and 40, then maybe results will come. But if you are 50 plus, it's definitely, you have to go to proper doctors, like medicine doctors, for checking up your blood sugar level, blood pressure level, your cholesterol level. Because if you have cholesterol, if you have blood sugar level, if you are a cardiac patient, if you are having pacemaker on your heart, and you have a lot of blood transfusion going on, you are a dialysis patient, then I may not recommend you to go through this Botox, fillers, and other cosmetic cosmetic procedures. Even if you have heart condition also, I prefer not to take this kind of cosmetic treatments, because it might give you other side effects like scarring or infections, or maybe if it's you are getting into some injections might go into your bloodstream, you might get thromboemboli and later go to other complications. So better if you are really having health issues like diabetes, thyroid problem, hormonal issues, especially when I come across acne problem. People get acne scars, a typical example, a lady came up with acne scars and lot of history of acne for many years, and she wanted me to go do some kind of surgery for her acne scars and treatment for acne. There was option like chemical peel, lasers, and also subcision minor surgeries, which I can remove the scar with other injectables. But when I saw her history, she had PCOD plus thyroid problem. So I told her to manage her hormonal levels. I recommended her some prescriptional drugs, and also told her to go and see gynecologist and endocrinologist, and then later we can see. And she was 36 years old. Then I told her to do exercise, to take less stress, don't drink, don't smoke, and take a lot of fruits and vegetables. Besides eating meat and fish and other things daily, you can take a lot of fruits, better for your health, a lot of vegetables, and don't skip meals. So these are the things which I actually prefer in patients before going through cosmetic procedures, because everybody cannot go through cosmetic procedure. We have to choose our patients very wisely. If they are physically fit, mentally sound, and they have not visited number of doctors for this kind of surgeries, I actually go for these patients. If they have visited lot of doctors and they have scarred their life, their mind, and their skin, I don't prefer this patient, because this patient is fit for psychiatry, and they need to consult psychiatrist, and they should get consultation from psychiatrist, because dysmorphic syndrome is very common right now in our young people, in our young adults, who feel they are very not up to mark, and because of their ugly features, maybe they are finding acceptance, identity, which is uh, good to know that they want to find the identity, but it's not good when they find themselves inferior to others, because everybody is equal, everybody has their own talent, their own special gift from God. So we don't prefer I don't prefer patients who are not mentally sound. They have got some kind of depression, anxiety, and they have gone a lot in their life, and lot of treatment from Delhi, Mumbai, they go to Bangalore and do all kind of treatment from all kind of doctors who are just concentrate on making money, because they know these patients are not going to come back again in those kind of metro cities where the treatment is so expensive. But for the sake of humanity, I prefer patients who are mentally sound, physically fit, and who needs the surgery for the beautification and enhancement. So that's how I guarantee people that your treatment will work, because this way the treatment will work, and there is a guarantee when you have a understanding between patient and doctor, and patient understands why they need this treatment, and doctor can explain them well, and a lot of other documentations are done. So this is how we guarantee. And of course it's cosmetic effect lasts maximum to 2 years. So you need sessions for, even for uh, platelet rich plasma therapy, you need sessions like 2, 3, 4, 5, 6, depending upon how well your body is responding to the plasma injection. And also you same thing goes to botox and fillers, but I prefer patients to go through at least minimum 3 to 4 sessions and see, and take a gap, change the lifestyle, and then I prefer further treatments. And for maintenance, of course, you have to use your skin care products, scalp care products, which I prescribe definitely after the treatment. And a lot of precautions are needed, like you should not smoke, drink, lifestyle, sleep well, eat well. Don't go for those kind of extensive diet, which nowadays, I don't know, I've seen a lot of patients prescription where dietitian is prescribing one roti per day, which I got shocked. Like, how can a dietitian prescribe one chapati, one bread per day? You need calories, you need to have good food for your skin. for your body, for your hormones. How can you get married and get produce children? How can you be happy without serotonin? You need to eat rice. You need to eat vegetables, you need to eat fruits, you need to eat meat, sometimes you need to eat eggs. So I don't know what kind of dietitians are there right now, what kind of nutritionists are there who are prescribing a lot of young girls very less food to eat and no exercise. That is very very bad, because a lot of girls will later on suffer from multifunction failure, multi-organ failure, and they might end up in coma in ICU. So better girls, especially the young girls I'm talking about, don't do dietitians, that diet which you take one bread per day and nothing else and just soup and drink water. That is called starvation. That's not called dieting, that's called starvation. Better you cut off the fat from your meal. You can have cheat meal day. You can enjoy your junk food, whatever you call restaurant food once in a while, and take small amount, whatever is tasty, but do exercise, and keep that in mind, that alcohol and smoking are one of the biggest bizarre right now in our health and daily life. Stress, anxiety, so these are to be managed by exercise and proper sleep and proper food. So these are the things which I came to know about the patients who asked me questions. So that's why I told guarantee depends upon your body, and from my treatment, the artist, the doctor, and also the way you understand and the way you are consulted in the clinic by the doctor, whether you should go through the cosmetic on treatments or not. So in my clinic, we have laser hair removal, IPL, which I do only for face or hands, and I don't do other part of the body because it is quite complicated right now. Maybe in future I will be starting tattoo removal, etc. But I don't have those kind of facility right now. I'm doing a HIFU, that is a very good instrument for people who wants to get reasonable facelift, wrinkle reduction, eye bag problem or dark circles. I have HIFU machines, where I use a lot of mesotherapy products, beauty products, and I go through their face, which is kind of a ionic ultrasonic radiation which I give on the face to lift the face and also to reduce the fat around the neck or on the abdomen part. So these are the treatments option which you can go through, and there are a lot of injectables for fat reduction also, Kybella injections which you can inject here, double chin or maybe in the belly. So these are the treatment options available, and other treatments are PRP. PRP is the best treatment which I always suggest my patient, because it's from your own whole blood which I extract, and I go through the machinery, centrifugal machine is there, where I extract plasma and I inject on your face, on around your eyes for dark circles and hair. And every time patient is very skeptical that what she's doing, I don't know, but when I explain them why they are going through this and are they fit or not, I sign all the documents, I explain them each line written on the paper. Then when they come for second, third, they see the effect. They see the effect and they say, yeah, actually this one is better. So the best option is PRP for any kind of wrinkles, sagging, or any kind of beauty augmentation on any part of your body, for scar treatment. It is the best option right now, PRP, and with 0.05% side effect. That is, you don't have any side effect most of the time, unless and until there is health problem in you. So that is to be scanned by lab test, and on the day of consultation, you don't come randomly to the clinic and just go through the treatment. You are consulted, you are explained, you are notified why you are going through these things, why you need cosmetic, and it's your choice. We don't force you, and it's your choice to understand the process, the procedure, why it is needed, what is cosmetic medicine, and then you go through it. And the pricing and all depends upon the time it's taken, the effect it has. So these are the things which we do in our clinic, and lot of patients are there right now who are telling me that the pigmentation was gone when you treated me. Now after 6 months it has come back again. I'll tell you, melasma is number one, hormonal. It is also known as pregnancy mask because it's hormonal. uh, Definitely only pregnant female don't get it. You can get it even when you are not pregnant, but it's hormonal. So it can come from if you have hormonal diseases like thyroid problems, or you have you have taking some kind of hormonal medicines, and maybe it's because of pre or post pregnancy problems also, and sun exposure lastly, and other diseases which you have in your body. So whenever you have pigmentation over here, over just above the eye, out on the cheeks, and on the nozzle area, that means sunburn. You have to need to have a good sunscreen. Take care of yourself, don't expose too much of your body part. Wear thin light clothes and cover it up. Wear a hat or a shawl or scarf, and wear sunglasses whenever you go out. Wear sunscreen SPF above 50, or maybe 30, minimum 30. Whenever you go to the beach side or riverside, always wear sunscreen and reapply it whenever it's extreme exposure to the sunlight. So, and moisturize after you come back home after wash. These are the maintenance things you need to do, and that's why it will come back. The pigmentation will come back if you don't care, and if you maintain a certain kind of creams, sunscreen, so it will not be there on your face. So you need to have sun protection. And what about the hair fall? Yeah, somebody has asked me, what about the hair fall? Is PRP going to last? Definitely, nothing is permanent on this earth, neither our life nor happiness nor sadness. Everything is temporary. So the effect is good, and the effect is always there, but it lasts about maximum 2 years, and you need to have sessions. That's why I always talk to patients about sessions, sessions, because some of the patient do one session, they get the result, they don't come back, maybe because of financial problem, or maybe they don't want to because they're so scared, or maybe they are just thinking about changing the doctor. So even if you go through 100 doctors, you need to do sessions. Maybe if it's financial problem, or your mind doesn't want it, then it's fine, it's your wish. Patient's need is the number one need. So patients, according to patient need, you need to do the session. So that's how I guarantee you that there will be regrowth, and the cosmetic effects are always maximum to 2 years. So some of my Instagram friend has asked, Sunita, what type of sunscreen suitable for dry skin? Could you please recommend? Yeah, definitely. If you have dry skin, you can use mineral sunscreen. La Shield is one of the best mineral sunscreen if you have dry skin. But if you have oily skin, I prefer Acne UV. Acne sunscreens are very good for oily skins. But if you have really dry skin, mineral sunscreen of good brands, whichever is suitable for your skin, you should use. But see that there are no lot of oxybenzone. If your skin is very sensitive, don't use oxybenzone or avobenzone type. You should always use sunscreen which has got titanium dioxide and zinc oxide, rather than benzene products or mica, because these are dangerous products for your skin. So that's the thing. And so good to know that many of us have joined, my friends have joined on Instagram live to know about cosmetic treatments. Definitely there are cosmetic treatments of vitiligo also. So one of the patient just asked me on WhatsApp, do you have cosmetic treatment for vitiligo? Is vitiligo curable? Vitiligo is sadly, we don't have scientists or doctors who have discovered the cure. um, Welcome, Sunita. Actually, yeah, my one of a patient who is suffering from vitiligo asked me, uh, do you have what is the cure for vitiligo? There's no cure for vitiligo, because vitiligo is an autoimmune disease which attacks the melanin portion, pigment hormone of your body. And definitely you get white patches, you have less melanin, so that's why the skin doesn't produce much melanin, and you get patches, uneven tone on your face, patches, white patches. And it's not transferable, because a lot of patient, one of my patient have made me sign the document where I should have, I should write, for her office people that it's not transferable. It's very sad to know in India that many of us are not aware that vitiligo is non communicable. It doesn't hurt anybody else but the patient, so we should consider those kind of patients. If you are in a working place, vitiligo patients are there, don't try to make them feel inferior by telling them that you can transfer your disease to me. No, it's not transferable. Vitiligo are mostly, it can have because of some medication, or maybe some environmental factors, or maybe genetic factors, or simply it may be autoimmune. So it is because your body is unable to produce melanin pigment in the skin. That's why they get this vitiligo problems. So definitely she asked me what about the cosmetic products. We have injectables, we have placenta extract injectables, and 5-fluorouracil chemo drugs, which I use with hyaluronic acid, and lasers, which is really treatable. After some sessions, like 3-4 sessions, you will see that the patches are gone, but it might reoccur again. And you must always check with your blood pressure, cardiac problem, cholesterol, liver and kidney function, because these medications might give you some kind of other complications. So before treatment and after treatment, you should always do lab test, and always should come for review, so that you're okay. But definitely these are the treatment, and vitiligo patches are gone with the injections, yes, but they might reoccur because it's not curable. But yeah, for some period of time, for maybe 2 years, you might not get it back. You have to actually follow with the doctor if you have vitiligo, and definitely there is a treatment, but unfortunately we don't have a cure. But there are treatments for vitiligo. Cosmetic treatments are available. And what about keloid? Yeah, somebody has asked me about keloid. Yeah, we have treatment for keloids. We have lasers, we have injectables, and keloid scars are to be seen and examined first, because a lot of patients have gone through multiple surgery, and because of the multiple surgeries, their keloid have become so big that it's unable to be treated sometimes. So it's better if in the initial stages you come to a dermatologist and cure it cosmetically, because there's a cure for keloids. I mean, there's a treatment for keloids, but there is a chance of reoccurrence. So that's why I don't say it a cure, but there is a treatment for keloids too. And one of my Instagram friend, Ria, has asked me, do you recommend using DIY scrubs on your face? DIY scrubs, definitely, why not? Actually, one of my army patient, he was on duty in Jammu, and he asked me, doctor, I don't have any pharmacy who supplies beauty products here, so doctor, can you recommend me some kind of DIY, do it yourself facial scrubs? So I told him, do you have coffee? Then he told me, yeah, I have a coffee. Then I told him, do you have a Vaseline? Then he said, yeah, I have Vaseline. And I asked him, do you have baking powder? He said, yeah. And then I told, okay, fine. Put petroleum jelly in the coffee, and some baking soda, and maybe 1 drop of lemon, and mix it with a little bit of clean water, and then scrub it on your face and just moisturize. And he did it, and I think this scrub was wonderful, because this is do it yourself scrub, which I have learned, and it's really good for your skin. Once in a while you can scrub, twice or once, according to your skin type. If it's really oily, don't do it so much, because if you scrub your skin when it's oily, it will think it's getting dry, and it will again produce more oil. So better to scrub it twice a week or once a week, if you want, according to the need to remove the dirt and the cell, the cells of our skin. So I will just do a summary about cosmetic treatment. So we have cosmetic treatment in my clinic, in our clinic, which has been located in Champasari More, Siliguri, and you can book it on WhatsApp 70700000787. It's the number of our clinic, and our coordinator and director will be answering it, and sometimes I answer it. So definitely you can call on this number And you can also DM me on Instagram, on Facebook, where there is a page called Neo Skin Clinic, and then you can book it and come and do the consultation for acne scars, for hair fall problem, for your wrinkles, sagging, for reduction of your fat, and also do counseling whether you are fit patient or not for the treatment. And we go through a lot of consultation, and then we go through the procedure. We don't go random procedures, like in some of the random clinics. I have heard that they don't even sign the documents for patients, but patient must be always handling the situation quite systematically, because it's your skin, and you should be very very careful with your skin treatments. And any problem you should consult proper dermatologist, cosmetologist. And definitely I'm not a plastic surgeon, but a cosmetic derma surgeon who actually beautifies the skin and gives you perfect skincare routine. uh, but still you have right to proceed with the further treatments. I do clinical examination, and I treat fungus, I treat a lot of other eczema and psoriasis problems too. But be always confident, because all my patients are beautiful. Whoever came, whoever comes, they all are beautiful. I just want to say, don't feel inferior, and no, like, until and unless there's an infection or some kind of scabies or herpes, vitiligo is not transmissible, acne is not transmissible. But definitely you should consult a proper dermatologist if you have herpes also. A lot of patients have herpes on their face, on the other part of the body. So you should consult dermatologist and get proper treatment. And homeopathy and ayurvedic I don't recommend, because these are supportive therapy. They are not the treatment, they are supportive therapy. It's like a multivitamin supplement. So better don't treat your skin with homeo or ayur, because they are just supplement. They are just therapies, they are not treatment. So that's it for today, and I hope your Sunday will go better and better, and life will change for better. Pandemic situation will be gone, and we all will be living in a healthy world, and we will be keep in touch with each other. And I wish and pray to God that everybody will be healthy, happy, and always beautiful. Take care. Have a good Sunday.